Okay, it's recording.
Yeah, good.
So we are live, and I think we've got Colin who is joining us. Hello, Colin. How are you? And then we'll just wait for a few others to join, and then we'll start at. We've got a few others that just keep signing up. How are you, Colin?
He's muted, I think.
Ah, he's muted. Okay. Okay. I've unmuted a lot of people now, so
Cool.
people are coming through, and I just everyone's coming in.
Hello.
Hello. Good morning, Martin.
Hello. Thank you for hosting this meeting this morning.
Oh, it's a pleasure. Thank you for joining us. Whereabouts are you?
I'm in Point Lonsdale in Victoria.
Oh, excellent.
And where are you?
I am in. We're in the Central Coast, so up in Avoca Beach.
Oh, very nice. Very nice.
And
Nice weather up there today.
Oh, it's beautiful. Yeah, absolutely stunning day. Really, really nice.
Oh, that's good. We've got cloud down here, but it was nice walking on the beach.
Oh, lovely. It's good, doesn't it? It just makes that difference, doesn't it? Getting the fresh air.
Absolutely, certainly vital at this stage, particularly.
Definitely.
Makes you feel a little bit more human.
I'm sorry?
Makes you feel a little bit more human.
It certainly does. Absolutely. Good, Adrian.
I'm in Central Bendigo, Central Victoria. We've got brilliant sunshine up here, about 19 degrees.
Oh, lovely. And have you been out for a walk or anything this morning, Colin?
Yeah, just did 8,000 steps. So my goal is 20,000 steps a day or 40 kilometres on the bike. So I've got to do that every day. Nothing else to do.
Yeah, it's nice to set those goals though, isn't it? Because it makes you get motivated sometimes.
I mean, who wants first aid at this time anyway? So.
That's right.
My wife's a teacher, and a bad day for her is under 20,000 steps as a teacher.
Yep.
She does on average 26,000 steps a day. It's amazing.
It's easy to do. I was a teacher, and yes, we certainly clocked up the K. And think it's only in a small classroom, but you get around and around, lots of laps.
Absolutely.
How many expecting, Mandy?
I'm expecting around 25, which is great. So, yeah, for our first session, it's pretty good. I think a lot of people are just interested to see, what precautions and what they can do from working from home. There's a fair bit of concern out there, so we just wanted to give some expert advice.
No, it sounds a great idea. Thanks.
Yeah. But do tune in. We're going to have a few more as well. So this is the first one, and we're going to hopefully have them every week or so. I've just started getting into it because I'm working from home with my active 4-year-old at the moment. So I have to set him up with a movie and get him don't come in and talk to mum while I'm doing this. And so it's all that interesting juggle at the moment.
I was going to bring the 2 Labrador puppies in, but I thought that might be just a little bit too much.
No, you should have. That would have been brilliant. I bet they're keeping you busy.
Yeah, I haven't had them here at the office. Normally that they are here at the office every day. But just at the moment, there's so much going on, it's just easy to have them at home, but I still then spend half an hour filling up the holes that they've dug in the backyard.
Yeah. It's like having children, isn't it? The responsibility.
Yeah. But the good thing about with the dogs, though, you can leave them outside as punishment. You can't do that with your kids so easily.
Exactly. So how long have we got? We've got 4 more minutes. So Colin and Martin, why don't you, for the 4 minutes, what are you guys up to with work-wise? Are you working from home yourselves?
Well, I'm retired, but I've got a little business, but no, nothing's happening at present time.
Yeah. And are you in first aid or safety or anything?
First aid, yeah.
Okay, brilliant.
Did a course and bits and pieces did a little business up, so I've got that organised in my retirement. But
Brilliant.
nothing's happening at present, like everybody.
Yeah, sure. You're just keeping stable through it and just getting through it.
That's it.
Yeah.
I do a lot of just volunteering locally and that, but that's not happening either. So walking up and down the beach is a big thing.
Yeah, for sure. We're really lucky to have that. I speak to a lot of family in London and the UK, and they don't have, those big open spaces so much. I feel very, very lucky over here to have that.
Oh, very good.
And how about yourself, Colin? Are you working from home, or are you?
Yeah, I'm actually on leave at the moment. I am a middle manager in the RTO that I work for. I actually do teach first aid, but we made a decision that we weren't going to do it. It's just open to too many problems, etc. So at the moment we're shut until at least May 12th, we've decided, and then we'll make a decision after that. I also teach white card training. I'm a chef by trade, so I do food safety as well. I've got a team of trainers underneath me that teach, all sorts of things as well. So it's feet up, and if I've got a weed in my backyard that's higher than 1 centimetre, I'm not doing my job properly at the moment.
Very good. And I think we've got Kylie who is joining us now. There's a few others all joining now.
All right.
Here we go. Here we go. We have Clinton.
Good morning.
Good morning, Clinton. How are you?
Excellent. How are you all this morning?
Very good.
Lost you all. Where'd you go?
Whereabouts are you, Clinton?
I'm in Western Australia.
Oh, lovely.
Early start for you.
It is indeed. Sorry, I've just lost all visual. I'm just trying to find you again. Ah, there you are.
Excellent. Well, thank you for joining us. I think we are ready pretty much to start. So I might just get everyone, if that's okay for the duration, just to mute now. And then what I'll do is we'll all, have a little conversation at the end and answer some questions just to make sure that we don't get any outside noise. You're probably used to doing these Zooms, but sometimes speaker view is a lot easier as well. So just a little bit of an introduction on myself. I'm Mandy Millen, for those of you that don't know me, and I'm the brand manager for Survival, and I look after a lot of the workplace partnerships. So I'm out there working with a lot of the safety guys, and I'm focusing a lot on the mental health and the safety and the well-being. And we wanted to put together these Zooms particularly to sort of add value and get some expert advice. And we know that nothing replaces first aid training, but we thought this conversation would help. So I'm just going to keep admitting people coming through. Without further ado, I'd just like to say thank you to Adrian Date, who's the Director of Vital First Aid, for joining us. Thank you, Adrian.
All good.
And perhaps if you just want to give a little introduction on yourself for everyone, and then we can get the conversation going from there.
Yeah, sure. As Mandy mentioned, my name's Adrian from Vital First Aid. My background, I had close enough to about 20 years as an intensive care paramedic up here in New South Wales. Also been running Vital First Aid as an RTO or as a business for about 25 years. And we've been an RTO for close enough to 20 years now. Predominantly delivering obviously first aid training. We also do a little bit of fire, the first attack and fire warden training. We also did sports trainer education for about 6 years. We looked after all sports trainers for the NRL nationally. So relatively busy.
Excellent. And let's get straight into this conversation, and we can get stuck in. And at the end, we've got any questions that come up, or if anyone wants to just message me through, I can stop and ask Adrian. So as you know, what's happening with a lot of uncertainty at the moment, everyone is starting to work from home. I know I'm feeling it myself, running a business, working with Survival. I've got, my son at home. 1 minute he's got like a wire hanging off him, and there's lots of stress of what could happen. Safety in the home, people are sort of thinking they've got everything set up in the workplace with compliance. So what are the key safety precautions when working from home? Let's have a chat and delve into that.
Well, I guess initially, just after what you've said there, the biggest concern I'd have is if that wire was connected to a plug in the wall and then turned on. So maybe keeping the wire splicers away from the sun as well might be a good idea. Look, we for many years ran vital first aid from home. So I'm obviously in an office now, but running a company from home is something I've been pretty familiar with for quite a few years. But I think one of the biggest things is, as an employer, but also as an employee, you've got to remember it's still a workplace. So those requirements for a safe workplace still apply, particularly for employers to make sure that your employees are safe at home. Now, obviously, it's their home, but that doesn't necessarily mean that their home's set up for working. Even little things like you mentioned your kids are at home. Normally, when you're at home with your children, you're looking out for them, you're with them, or making sure that they're actually safe. When you're doing, say, like a Zoom seminar like this, your focus is going to be on your work as opposed to the kids. So your field of danger, I guess, expands quite a bit to what it would normally be. I guess there's also other aspects as far as your own health. Quite often when you're working from home, you end up just sitting down for long periods of time. So there's issues associated with that as well.
Yeah, so that's linking back to, I've got some questions from Clinton who just jumped in saying, what's NRL? Is that something you mentioned before?
That was just pure Western Australian sarcasm. Sorry.
Yeah. Well, they've got a new boss there now, so you never know your luck. We stepped away from them a while ago because of issues with the hierarchy there. So, yeah, I appreciate the humour, though.
And ergonomics.
Yeah. Sorry, Mandy?
And ergonomics.
As far as safety at home?
Yeah.
Yeah. Obviously in normal workplaces, the things are set up, or a good business is set up to make sure that their staff are moving around, even standard desk type setups where the staff are standing rather than sitting and things. So often at home, an improvised workplace might be set up. So making sure that, say, those things that are normally safety issues at work come across into home as well. So making sure your staff are getting up. But even other things like at home, often people might be at home by themselves. So making sure that there's contact with your staff members, touching base with other staff members regularly during the day to make sure that they're still safe and still around there. So there's different aspects of the safety that can be incorporated that might not normally be done when you're working from home.
Yeah, and no, and I think that's right. I think people have sort of just fallen into this and not sort of thought about it. Whereas we've noticed as well, people realizing, well, this could be going on for longer than expected, and so they are starting to now think, well, what do we need to do? What in place for our teams, and what can we set up? Yeah. So it's just a matter of getting their heads around that now and getting everything set in place.
Even we're obviously you guys are from a first aid kit supply organisation, just making sure little things like that your staff have first aid kits available to them. It's one of the things that we've seen, and you would have as well. Many homes don't have an adequate first aid kit, and if you've got staff members working at home, there could be legalities if they injure themselves during that day and don't have a first aid kit available. So it's not a simple case of having your staff, I'll work from home. There's logistics that need to be looked at as well.
Yeah, and that's from the legalities point of view and a compliance point of view, that is the responsibility of the employer still, that they do have first aid available to them.
Absolutely. And so that's I think it's very easy to sort of say, okay, well, to your staff members, you've got to start working from home. And maybe send them a laptop at home and a phone or something like that. But there's more to it, even just notifying insurance companies that you've got staff working from home as opposed to their normal office space.
Yeah.
But certainly having the facilities suitable. So, good chairs for them to sit at, an appropriate table, things like first aid kits, making sure that the staff have got those things that they are required under law to have.
Yeah. Yeah, for sure. And then moving on to the next step, which was management of everyday injuries. I think that's yeah, I mean, this is obviously where you come in, and you know that you've had a lot of dealing with people with injuries at home. So do you want to go into that a little bit more?
Yeah, I think just that, you know, the basics often, and some of the people that we've got online today would have seen it, where particularly the people that do first aid training, in a workplace, you might only have 2 or 3 people that are trained in first aid. So if someone gets, even just in an office space, cuts themselves, a paper cut, for instance, but maybe something a little bit more serious while they're getting themselves lunch at home while they're working from home, they might normally have turned to the first aider that's available. If they're working from home, that first aid is not going to be available. So they need to have some idea and the equipment to help them, because at the end of the day, the employer is responsible for them whilst they're working. So remembering things, just basic first aid as far as cuts and abrasions. The biggest thing with those is making sure that they're washed and spending the time to clean them properly, and then applying ideally a non-stick dressing to them, so to help prevent infection and ongoing care of that wound. The other thing that I guess is a big issue is staff that might have cardiac issues working from home. During the week, they got 5 days a week, 8 hours a day where they're at a workplace. So if something happens to them, another employee might be able to notify and seek medical advice very quickly, whereas at home they're not going to get that. So just being aware of medical issues that your staff might have as well, which means you might need to sort of touch base with them a little bit more often.
Yeah.
Again, with cardiac issues, I've found, particularly as an intensive care paramedic, if someone's at home, at work, and they get a bit of chest pain, they're far more likely to mention it to a workmate that they've got some pain, and then obviously get assistance summoned. Whereas if they're at home, from my experience, they're more likely to wait. They think, oh, I'm at home, I'm in a safe place, there's no one really to talk to, so they don't mention that they've got chest pain. So that type of thing certainly could become an issue.
Yeah, excellent. And in terms of critical steps, like when you should call for an ambulance, I mean, obviously we don't want to freak people out, but we've mentioned this before previously, that, you know, there is a shortage at the moment of perhaps ambulances in certain areas. So it's key for people, I suppose, working from home now to understand those critical steps. So again, do you want to go into that?
Yeah, absolutely. We fortunately haven't noticed it too much here in Australia. Some areas it's maybe a little bit more than others, but we will start to notice a bit of an increase in response times for the ambulance. It's just going to happen as more people are taking up space in hospitals. They've noticed it particularly over in the UK, where response times have extended out quite significantly. So if you are calling an ambulance, recognising that you're going to have to wait a little bit longer, which means that you're going to need to look after either yourself or the patient a bit longer. But also being smart as far as when you do call an ambulance and when you decide to wait. To me, the must-call ambulance situations are chest pain, query stroke, fitting. Certainly if the patient's unconscious, they're all straight away call an ambulance. But just being sensible as far as for even relatively significant cuts and things, maybe thinking, well, can we treat this cut and take the patient to a doctor as opposed to a hospital? Because I think particularly at the moment, staying away from hospitals where we can is a good move.
Yeah, for sure.
But also making sure you've got access to, if you've not necessarily done a first aid course, but having access to information as far as what to do. So for things that may be a little bit more minor, so cuts and abrasions, taking the time to look up the management of those cuts and abrasions. And I guess that's where your first aid book and online assistance is great. It gives you some good basic information on how to deal with those situations.
Yeah, and I suppose what comes into that as well is, like you were saying, is in the workplace you usually have that dedicated first aider, or if something happens, you just think, well, Johnny is our first aider, he knows what to do, or we've got everything set up. Whereas if something happens at home, and with the anxiety which is out there already at the moment, sort of adds to that, and people, if they haven't got the first aid kit or they haven't had any training, it can lead to panic and
Absolutely. I've seen it often where, particularly major events, where you got a couple of people, someone that's badly injured, and you'll get people that have stood back and said, oh, I'm so glad that Frank was there. He's our first aider. I wouldn't have been able to do anything because I've done a first aid course, but I just panic. I would have been hopeless. I'm glad Frank was there. And I generally say to people that that's fine if Frank is there and you can step back and let him take over. But if Frank isn't there, I'm pretty confident that most, if not all, people will step forward.
Yeah.
I don't know if I mentioned to you before, but I remember one particular situation. I went to a paediatric or baby cardiac arrest. This was quite a few years ago. This baby was only about 3 months of age. My daughter, my firstborn, was exactly the same age. And I can remember walking in and looking at this baby on the bed in cardiac arrest. And all I could see was my daughter laying on that bed. She looked like my daughter. She smelt like my daughter. It was, just in my head, it was Emily laying there. And I very, tears welled up in my eyes is natural. If there'd been another ambulance officer there that could take over, I think I probably would have stepped back and said, "No, that's it, I'm gone." But the other person I was working with, they had pretty much lost it. They'd never dealt with a paediatric arrest before, which I'd dealt with quite a number. So I couldn't take that step back. I had to do something. This baby's life was in my hands. So I did what I tell people always, if they find themselves starting to get a little bit panicky, is to physically take a step back.
Yeah.
Take that deep breath in and out, refocus. Remember that to me, that golden plan that we've got, that DRABC, I know there's extra letters, but I'll still refer to DRABC. Revert back to that. That's our plan as far as what to do next, and get into it. And in my situation, I stepped in, and the job itself went really well, as I'd hope. And I think most people are the same. They think that they will panic, but if there's no one else to do something, I think most people, as long as they got that plan, they'll step forward and do it.
And I think that's where, even as myself, is a parent working at home now, and there will be lots of parents with the same. And now you've got that added responsibility of worried about first aid if something happens with your children as well, is having that support. So, is key with companies like yourself that are still offering training online for teams who are working from home, so they have got the education, and also having really good, well set out first aid kits or books, so they're ready if the accident happens. So if they do panic, at least they know they've either had the education or they've got the resources that are there.
I think that's really important, and that's we've seen, and I've seen professionally where people, as long as they got something that they can refer back to, it's not necessarily that they're going to do that, but the knowledge that they can do that if need be. So I think most people have got enough common sense to know what to do. If someone's bleeding badly, well, plug the leak, hold it, try to plug it. But knowing that they've got access to a first aid kit, got access to other additional information, just helps that confidence level. And I think I can get in and do that.
Yeah, and it just helps with, it supports your mental health because you know that you've got that covered. Absolutely. So it's not another worry on top of everything else that's happening at the moment.
I think we're all pretty much at tipping point. Every day is, as people mentioned, there's not tomorrow, it's just today. And that's enough to deal with. So as soon as you start to throw something else in the mix, and particularly if you're working from home, our chat that we had last week, you got the kids running around and stuff, and I could tell that you're a little bit stressed with it. It didn't worry me, but I could tell that you're a little bit stressed with that.
Damn it, I thought I was being calm.
But I get that the same here. I said earlier that I haven't been bringing the dogs in because everyone here is a little bit more stressed than what they would normally. And it's just, you think, well, look, I just can't deal with anything more. So I think if we can eliminate or decrease, mitigate those stress factors where we can by having things like first aid kits and the knowledge or the resources is an important thing for us, but also for our staff and the other people that we're working with.
Yeah. So let's the last point before we go into then like our offerings as well and how that's going to help support people. We've talked about support and guidance for your own personal safety. So is there anything key takeaways that people can really think about there and for their teams?
Yeah, look, I think being, you know, obviously making sure that your teams have access to the basics, first aid kits, etc. Remembering also, and I think it's more generalised first aid, we always talk about danger as being the number one, the first step that we take in any emergency situation. And one of those dangers is infectious diseases. People always automatically think of HIV, hepatitis. We're all a little bit more alert now to this other thing that's out there, COVID. So being smart with your treatment. So if you do come across someone that needs first aid, you don't necessarily need to rush in and be close to that patient, touch them, apply dressings and things like that to them, which is hard for some people. I know for me, you know, I like that contact, but you need to be smart. So that might be doing things like passing the patient themselves a dressing, get them to wash their own wounds so you can stay away from that patient, you know, the 1.5 metre isolation area. So just being smart, protecting yourself that way. Even things like if you had to do CPR on someone, consider compressions only. Breathing is still very, very much of an essential part. I think some organisations underrate how important the breathing component is, but in this day and age, particularly if you don't have any face shield or anything, just doing compressions only, just smart things like that, trying to reduce your own exposure.
Yeah, but I think even with that, like you're saying, you know, performing CPR, I think if you haven't had training in that, if you've got work teams who haven't had training in that, or they haven't got, we talk about first aid or anything available, you would just sink into panic if you didn't have any understanding of CPR.
Yeah, look, I think in some cases you might, but even, you know, I've been to countless number of cardiac arrests in my career. Very rarely is there a situation where people aren't doing anything. Normally there's someone that's going to step up and at least even just do compressions, even if they're not effective.
Yeah.
And I think that's, you know, remembering that anything is better than nothing. Mm-hmm. And you mentioned before, as far as your own mental health, walking away from an incident like that, thinking that, you know, you could have done more is no good for your mental health. Just remembering that anything is better than nothing, and what you've done is for the patient is giving them the best opportunity.
Excellent. You know, that's really good advice. I think just even that is anything is better than nothing. Thinking like when you freeze, because when fear and panic kicks in, even though you've got the adrenaline as well.
Yeah,
you know, it's like,
I think that's again where we're just remembering that, you know, I mentioned before, as far as just and I did it on occasions in the ambulance service where I would physically take a step back. I'd step up away from the patient, take a step back, take in the whole environment again to make sure that I'm safe, reassess my priorities. So go, you know, bouncing back to that DRS, A, B, C, D. So refocusing and then getting back in and doing it. I think that's the key with everything. If you're finding yourself starting to get a little bit anxious, it's just to physically step up, take a step back, reassess, and then get back in with a new plan. And normally that helps.
Yeah, for sure. And how are you finding now with your work teams that you've been working with that now you're able to deliver first aid training online and still support people that way?
Yeah, look, we looked at a few options as far as online. We're sort of developing a bit of an online type of component. I know that there's a couple of organisations that have gone pretty much fully online with just a very, very short assessment component. I struggled with the idea of doing that. For me, I'm a trainer who just happens to assess. And the idea of getting someone in for half an hour, for instance, to make sure that they're doing everything in their practical component properly just doesn't work with me. There's so much communication, two-way communication that occurs in a face-to-face course that can't occur over Zoom. It certainly can't occur just purely online training. It occurs in a face-to-face situation, and that for me anyway, I might be old-fashioned, but for me that's essential in a first aid course to really gain those skills, and for me to know that the students, even just subtle body language indicating that they don't quite understand what I'm saying. They might understand enough to get the question mark right, but they might not understand it fully for them to walk out feeling really confident. So we've sort of, I'm not overly keen on the online component for first aid training. I think it's just one of those subjects. Some subjects can be done online, fine, but I think things like first aid, for me anyway, in the direction that we're taking. But in having said that, we recommend a lot of places to watch the videos that we have on our website, to read first aid books like your online stuff, just to consolidate that confidence that they have in their training. I think that's an important part for staff and for people.
For sure. And with going into Survival's first aid kits, which is how we've become partners, obviously you refer Survival for your teachers, for your clients that are coming to your club. But what do you think in terms of the Survival first aid kits? Why are they so important right now?
Look, as I mentioned to you guys the first time that I met you, I've obviously seen the Survival kits around for a long time and didn't think much of them, to be honest, to start with. But I think I know that was because I'm looking at it from a paramedic's point of view. Seeing a kit that's got all the bits and pieces labelled and clearly identified, to me is a little bit of waste of my brain power.
Because you know it.
Yeah, because we know it. We know things intrinsically well. But when I talk to or show them in our first aid courses, my trainers are of the same opinion as me. But then when we start listening to our public in courses, our students, they open them up and they say, "Oh, isn't that fantastic? Everything's labelled. I know where everything is." And I've seen it at car accidents where you get a first aider there with a really nice first aid kit, maybe a big solid first aid kit, and there's heaps and heaps of stuff in there. The typical scene is where there's virtually nothing left in that first aid kit because everything has been thrown out because they're trying to find one Band-Aid, and in the panic everything gets thrown away because they don't really know where anything is. Whereas I know that your kits, because everything is labelled, it's clearly identified, people can very quickly find out and work out where the dressing is, or the water, or the wound wipes, etc. They're very quick and easy to find where that is. So
do you want to just hold that kit up as well for those of you that have joined us? I recognise a few of you that are fans of our kits, but just because you've got it there. But if you open it up as well for us, Adrian, just what we're talking about, for those of you that haven't seen it before, that's the labelling there, which is, just outline.
This is their travel and vehicle kit, but also can be used as their home kit. You can see, it's a bit hard to see on the thing, obviously on their website, you'll see it properly. But the kits they're compliant kits, so it's fine for a workplace, fine for a vehicle. Everything is labelled up well, even colour-coded, so you can see it very, very quickly where things are. You can also see if things are missing. I know even as a intensive care paramedic, you get to open up your first aid kits and the last person that was there hadn't replaced something. Whereas this kit, it's very clear where things are meant to be.
And I think Jim, you just made a comment as well, which is really key, which a lot of people don't see at first with the kits, is the labelling. It allows people to see what has been used and what is missing, and that's a massive component. Underneath the labelling of what that product is, whether it's Band-Aids, it will tell you how many Band-Aids are required. So if you look through and see, there should be 5 and I've only got 2, you know that you need to restock 3. So even if you're working from home and you're going through those because your kids are using them, you just know that you're keeping up, with compliance, and you've got everything ready there. You don't have to have that stress of what have I got at home in my first aid kit.
And that's a really important part. we obviously, well, we used to go into organisations and restock kits. It's something that we don't do anymore, but the number of times I'd open up organisations' first aid kits, and even now when we do occupational first aid courses and things, and you open up the kit and there's stuff in there, but it's certainly, I can tell very quickly that it's not compliant with all the bits and pieces. Now, if they had a safe work or work cover inspector come in, it's very, very unlikely that that work cover inspector or safe work inspector will fine them for having a kit that's not quite compliant. You're missing some band-aids or whatever. It's very unlikely that they're going to do that unless you've annoyed them by doing other things. But it does put you on the back foot. And when you've got a situation where you're saying that you are compliant in all aspects of your workplace, but the inspector's seen that you've only got 2 band-aids left where you're meant to have 50, it's very hard for you to be able to justify that you can't even keep a first aid kit compliant. So what else is going to be non-compliant? Whereas, so when you've got a kit that clearly tells you what you're meant to have in there, it makes it easier for everyone that's involved to say, hang about, this kit's missing such and such because there's nothing in the pouch where it's labelled it's meant to have.
Yeah. And it's just saving, a whole lot of headache, whether it's in the workplace and you are restocking and, you're responsible for that restock and keeping everyone safe. But even relevant to this discussion today, which is if you're at home and you are working from home for a long time now, and lots of teams are for workplaces, that that you've got everything laid out. When I was first introduced to Survival, when I came on board, I was just blown away by the product, as I didn't think I'd be using it. And there's been a few times now with my husband who's been doing DIY or something at home, and I've gone to the first aid kit, but even though I've been trained in first aid before, I was suddenly in that panic. But there it was. I opened the kit up and straight to bandages, straight to dressings. I knew what to do. I had my app. So for me right now, what's really key is that people know that anxiety is taken away. They've got a very well labelled, stocked kit, which is easy to use. And we've also then got the iFirst Aid app. So for those of you that haven't seen that on their phones, it's the iFirst Aid app, which Survival provides for free as well. And that will just take you through. If you click through to first aid, you've got CPR, bleeding, burns, choking, and it will just take you through step by step what you need to do. So if you have got teams at home and you want to look after their safety, a first aid kit and the iFirst Aid app, it's a no-brainer because it's going to keep them safe. They'll know what to do.
I think the other important thing with that app, Mandy, that it sounds really stupid, but I've been sent many times to an address and we get to the address and there's no one home. So our coordination centre will ring up the caller and say, an ambulance is at the address you gave us. Where's the patient? And in the panic, the caller has given the address of their home because they just sort of thought, my home address, and they've given that. Whereas an app like this, you've got the facility there, even just down to things like showing your address. So it just reminds you about where you are, which sounds really silly. Like, of course I know where I am. Yeah. But often people in a panic situation, it's not necessarily something that's going to be simple for them to remember. Yeah. And not so much now, but when we're back at work, people know where to go to work. But I remember I worked at the ambulance station just close by here, Point Clare. If someone asked me the actual address where we were, I'd have no idea. So if you're calling for an ambulance, they're going to want to know that address. They want to know the cross street. If you don't know those, if nothing else, it just increases that anxiety level.
Yeah, for sure.
You also mentioned about the first aid kits. I think slowing down at an emergency is really important. And these kits, because everything's labelled, it slows you down a little bit by you're actually looking at the things, which again, it sounds silly. It sounds a fairly minor thing, but I know from a personal experience, if you find yourself starting to get a bit anxious, everything gets rushed. Yeah. If you can just take that step by step, slow things down, it makes it much easier to deal with situations.
It gives you that opportunity, like you were saying before, to just take a breath and actually, which then slows down that anxiety to sort of read and go, okay, this is all set out. What do I need to, what do I need to now use for this celebration? Yeah, that's a really good point. Well, look, we're coming to the end. What I wanted to do was just open it up to some questions. If anyone has any questions, by all means, you can unmute now and ask away to Adrian and I if there's anything relating to the survival products, to first aid training, working at home, any stresses you have, please go for it now.
They're all gone quiet.
All gone quiet.
Not a question, but I will say that this conversation reminded me I need to go and find my first aid kit. I actually moved house about 3 weeks before we went into this situation, and I've got no idea where the first aid kit is, and I probably should. So I will go and hunt for it when we hang up from this call. Thank you.
Excellent. Thanks, Mark. Yeah, I think that's it. It's one of those things where you think, oh, it's always there. See, now working with survival, I've got lots, you know, my husband who's a tradesman, he's got his kit. You know, I've got my kit in the car, I've got my home kit, like it's all set up. I don't have that stress. But when you we don't want to panic people, but it's just nice to know that now you've got that available, you know, and that you're ready in case something happens.
Yeah, indeed. Jim's asked a question there, what the post-COVID first aid kit going to look like? What do you mean, Jim?
Can you hear me?
Yep.
Yeah, hi, Jim.
I'm just sort of wondering, we have the individual sort of packs available, the personal first aid kits with the mask, the gloves, for doing CPR. Do we need to sort of start sort of carrying around something a bit larger, which has got masks, some skin wipes, something else just for going to and from the shops?
Yeah, look.
So a step up from the CPR kit.
Yeah, I mean, we just to let you know as well, we have a hygiene pack with survival now, which is going really well. I don't know if you've seen that, and I can send you the link after. Yeah, so that's that's with the skin wipes, the mask. I think, so I don't know, Adrian, in your experience, do you think that's enough right now for people?
Yeah, look, I think it is. Maybe I got my head in the sand a little bit too much, but I think that even at the moment, the social distancing is the key, and washing your hands is the key. You know, the mask and things like that. The masks have really proven more to be protecting us if the patient's wearing a mask that's got COVID or whatever, not so much protecting ourselves. So I think the hand washing is the biggest issue, particularly with a first aid type situation, as I mentioned before, trying to distance yourself away from the patient where you can. I think sometimes patients are useless, but they're not totally useless. If they've got a cut on themselves, you don't have to wash that cut and don't have to apply the Band-Aid yourself. Encouraging the patient to do that. And that enables you to keep that 1.5 metres away from the patient. I think they're important. Certainly having things like hygiene kits at the moment is a good idea. But from a first aid point of view, just wherever possible, maintaining that social distance away from the patient.
Yeah, for sure. Are there any other questions?
Well, thanks for that. The other question I had, the hand sanitizer deliveries, are they still sort of on track for delivery?
Yeah, they're still on track. Just depends when you ordered it. We can come back to you and let you know. I can follow up with you after this and get you an exact date. We've just, with everything that's going on at the moment, there's just been a few headaches with air freight, you know, internationally. So, but it's all coming along now. So yeah, it's really good that we've been able to support people with that. So that's all coming through. So if anyone else needs any hand sanitizer, or as I said, with the hygiene packs, we've got masks, gloves and skin wipes for those that are, in sites that really need them. Okay. Any other? I've just been joined by my 4-year-old son, so I told him not to, but I think he quite likes to be involved. So does anyone else have any other questions surrounding first aid at the moment, or what they can do at home? Jim, are you looking after a team yourself?
No, I'm basically just sort of trying to sort of look after myself and the family. But I am still sort of going on to work. I'm trying to, but on occasion I am being asked to sort of provide support to the workplace. Yeah. So I'm currently working from home, but we've got some people who are still working from work.
Sure. Okay. Yeah. And I think it's like what Adrian was saying. Same with my husband, he's working in construction, and it's just being sensible, isn't it? You can have all these, hand sanitizers and gloves and masks available, but it's that distance is key. I think it's just keep.
Yeah. And the other issue is just sort of availability of stuff at the moment.
Yeah.
And presumably this is not going to be a short-term thing that we're in for the long haul. So we need to sort of start thinking about this in forward planning.
Yeah, for sure. Definitely. Yeah. And that's why we put this out, these Zooms, is that we want to make sure that leaders or people that are looking after people in the workplace is just to make sure that safety is important at home. And people should be thinking of that as well. Not always people that are going out to work, but people that are at home as well, to not forget that first aid is important there as well.
There's also, and it sort of leads into more your field, Mandy, as far as people's mental health. When we are working from home, we're losing that social contact, and some of us will deal fine with it, others won't. I know the ambulance service is already, and it's not much in the media at all because it's not really something that they want to talk about, but the suicide rate, even here on the Central Coast at Gosford, has substantially increased.
Yeah.
Both suicide but also attempted suicides. And that, I don't know the exact numbers and obviously the causes, but my experience would strongly suggest that it's directly related to COVID, as far as the stress about it, the social isolation, the tipping of people over their stress limits. And we see it around Christmas time, an increase in suicides then, because people are feeling isolated. They don't have family, whereas everyone else is dealing with their family and things. So this is only going to have the same sort of effect. So
yeah,
watching people's mental health, it's just as important as first aid. Touching base with people, keeping in contact with people as much as we can, and still keeping in contact with new people like we are today.
Yeah, I think it's a great way of staying connected like this, and even still having conversations with people, and even the guys, we were mentioning earlier, is just getting outside and setting a routine for yourself and having those well-being tools at hand. And even for the workers is making sure that you're checking in, people are staying connected, people have got a routine, they've got some well-being tools at hand, and like you say, it's just being aware of that and not making it all about COVID, but also, like you said, that there are other issues at bay with mental health. So and that's we will have our next Zoom session. I'll be going into that a lot more. I'll be talking about wellbeing tools. So I'm excited to do that. Excellent. Well, we have gone over by about 10 minutes. Which is a good sign, shows that we had a lot to delve into. If anyone has any other questions, do speak up now. Otherwise, we would like to say thank you for joining us.
Thanks, guys.
Yeah, and we wish that you have a lovely day and you stay safe and well. And if anyone has any other questions, do you have another question? Mark, did you have a question?
No, not for me. No, just wave at somebody else.
Oh, you can see the hand coming up. Okay. Anyone has any questions, then obviously you can reach out to me or Adrian directly. I think you'll see that we are all connected on LinkedIn. And thanks for your time.
Thank you, everyone. Appreciate the time.
Take care. Stay well.
Thanks,
stay healthy. Take care. Bye.
Cheers. Bye-bye.
Bye-bye. Bye.